Welcome. I am Les Roy Williams. Today I am going to be interviewing two gentlemen on the HIV AIDS situation in our federation and further afield. I have with me Dr. Matthias Offre, who is the National HIV AIDS Program Coordinator, and additionally, I have William Chen, who is the project manager for the International Cooperation and Development Fund, better known as the ICDF. Gentlemen, welcome to both of you.
Thank you.
Now, the HIV and AIDS epidemic really has been eclipsed somewhat by the COVID 19 pandemic. All that we are hearing these days is about COVID 19. But COVID 19 is not only the only health issue that people have to deal with. There's still cancer, there's still a lot of other diseases and so on that, healthcare systems really have to deal with. But COVID 19 is dominating the airwaves as though there are no other illnesses, but there are. Now, I guess it's because COVID 19 is not only directly causing high morbidity and mortality, it is also disrupting essential systems for health and undermining programs to address HIV and other global health priorities. Repurposing HIV service and healthcare workers, travel restrictions, worsening social and economic contexts are also disrupting continuity of services. At the same time, the world is prioritizing its focus and efforts to slow the spread of COVID 19. It must also redouble its efforts to ensure an uninterrupted supply of essential commodities and services to respond to HIV and other global health priorities. Now, Dr. Offrey, what are some of the comparisons of HIV and COVID 19?
Thank you for that question, Mr. Williams. Each emerged as poorly understood diseases with limited treatment and prevention measures. It has both have widely spread across the globe and affecting the most vulnerable, and has created and has it have a very great impact, negative impact on the health and social economics and social supporting system as well as the economy. Of course, both has a conscious prevention measure like putting on a mask and wearing condoms, social distancing, and hand sanitizing and so on and so forth. Basically, so both of them are still things that we are learning more about and putting more effort to ensure, that the spread can be mitigated.
Mhm. Okay, now the pandemic, the COVID 19 pandemic, has impacted services provided to persons by the HIV Secretariat. How has this impact to persons? Um, what is the effect?
The pandemic has impacted and has a great effect on the services. One, the services, access to services we render. Since as COVID-19 rapidly spread in 2020, outpatient consultation greatly declined due to some reasons. One being that patients were scared of being exposed to the COVID-19. And the other aspect is that due to limited access, you know, means of transportation, due to the curfew and the travel restrictions, patients were actually finding it difficult to access health facilities. As such, um, the other aspect also is access to information. What the National AIDS Secretary, the Minister of Health, does one of our programs is sex education, and that is done in schools and also in business places, mostly in schools. So, due to the early closure of schools, it inhibited our program by reaching out to young, the students and young adults, to educate them about what HIV is and how to, to abstain, sexual abstinence, and also the use of protection commodities like condoms and how to properly use it. So that medium affected us greatly, and with lack of insufficient information and education system for those young adults, it increased the chance at which they are exposed to the virus. They are exposed to the virus. As such, they are more prone to be infected with HIV. But if with a good education system, that will encourage a good health seeking behavior, like getting tested, like also the use of protective commodities made available, like the condoms and so on and so forth. And I will say this, that due to this pandemic, the number of tests have dropped globally about 41%. And if there is a decrease in people being tested, of course we know what it is. It might lead to an increase in the infection rate.
Yeah, I suppose that the number of tests has decreased because there's more testing being done now for COVID 19.
Yes, we can see that the refocusing of goals and services have been channeled to COVID-19. As such, other health priorities have been affected somewhat. And the fact that we know how this COVID-19 spread, you know, we that has greatly affected the way we do our outreach. We normally go out to do outreach. We reach out to people, talk to them one on one, have a close consultation sessions with them, but we can't do that because of the spread.
What about, for example, Dr. Offrey, the healthcare systems in various countries, that the resources are channeled now into fighting COVID 19 rather than fighting HIV and AIDS? Are the resources affected?
I would say
Because you would find that in healthcare right now, a lot of the resources in countries, and of course, many countries have limited resources, governments and so on. And their focus now is buying PPE and making sure that they have all of their hospitals are fitted with ventilators and all of this sort of a thing to combat the COVID 19 virus. How is this affecting the resources that have been channeled into fighting HIV and AIDS?
the thing about is that the funds made available to enhance the hospital system or the health system in all its ramification will be greatly affected, as well as you said, that all other health priorities will be affected because we all, or the government, or the nation, the nation of the world, are repurposing and also channeling all the resources to the fight of COVID-19. As such, those that need actually the increase or the availability of commodities like condoms, male and female condoms, the use of lubricants, all of those stuff will be repurposed to COVID-19, to the buying of hand sanitizers and temperature checks and all of those stuff. As such, it is affecting all the communicable and non-communicable diseases.
Right. Now the people with HIV and AIDS fall into that vulnerable group in terms of contracting COVID 19 because it's a disease of the autoimmune system.
It's actually, as we stated, those that are the elderly and also those that have some serious underlying medical conditions are prone to more serious effect of COVID-19. However, knowing that those that are HIV positive also are in that margin if they are not adhering to the use of their medication. So if you are HIV positive, for example, and you are not adhering to the medication, you are predisposing yourself to even a more deadly or more serious or chronic exposure rate, and also symptoms that comes with the COVID-19 exposure or being infected by COVID-19.
Just like persons with diabetes or hypertension, if they don't have it under control, then it makes them more vulnerable to to the COVID-19 and puts them in a more precarious position.
Yes. The thing about it is, Mr. Williams, if you statistics have shown that people that actually dying from COVID-19 have underlying issues, that are not under control. If you check them, they're either obese or they're diabetic and so on and so forth. That's why we encourage that if you have an underlying issue, you visit your physician to ensure that we put those conditions under control before you are, in fact, to ensure that when you are exposed to coronavirus, because it's out there, when you're exposed to coronavirus, it won't be fatal. It won't be a thing of great concern that you might be hospitalized and possibly die from it.
Right. So the whole thing is to build the immune system.
Build the immune system.
So the immune system is not compromised. If it's
Yes.
compromised, then your whole health is in jeopardy from the COVID-19. Now, globally, HIV testing has decreased. Um, and what does that mean for infection rates if the testing has decreased? Just like COVID-19, I mean, the results that we really get in terms of the positive cases are based on testing, how much test is basically being carried out. And basically, how much test is being carried out can give you an idea of the infection rate and help you to basically know how to act or to put certain measures in place.
Of course. If you notice that if there is a decline, as it is actually globally right now to 41%, that greatly affects the outcome or the approach at which we can, and strategies that at which we can lay to combat the spread of this HIV virus itself, as coronavirus is spreading. That can also spread. Although it's not physically seen and has a little or shorter time frame at which it manifests, it could actually increase. So as such, in the aspect of repurposing all our focus, prioritizing all our energy and our effort to mitigate the spread of coronavirus, such energy should be put, in fact, redoubled in ensuring that essential commodities, essential services are made available to, if not stop, mitigate the spread of this deadly virus.
Yes, because of course, people are not going to stop having sex. And of course, they're having sex, and it's a double jeopardy now because you're having sex with somebody. But of course, you're also exposed to the COVID-19 as well.
Yes.
So, I mean, those preventative measures of course, sanitizing and mask wearing and all of those, even though you can't socially distance during sex,
Yes.
but those things, become very, very critical.
I think one of the questions I was asked some time ago is, um, somebody met me on the road and said, Dr. Ofrey, um, can I have sex even with this pandemic, going on? It's something I cannot do without. I was like, um, you can have sex, but I will encourage you to have sex with somebody that is in the same household with you. In other words, if you have your girlfriend that's living with you or your partner is living with you, you should stick to having sex with that person. However, we know people will not 100%, may not 100% stick to those rules. We encourage that while if you may have sex with somebody outside your household, outside close proximity, you should ensure to apply those non-pharmaceutical protocols, like ensuring to put on your mask, ensure to sanitize yourself, ensure you can't social distance in that aspect anyway. So ensure that after that process, sexual intercourse, you ensure that you take a shower, wash yourself with soap, and keep yourself clean. as much as possible.
Yeah, I suppose part of the whole process of sex and all of that, you're speaking about putting on the mask, but of course kissing and all of that sort of a thing, and foreplay and all of that sort of a thing may become an issue. But that's another topic all in itself.
That itself have to be reduced. That's why we have to apply wisdom in every action, in every activities we carry out. So if you if it deplete or it has to do with you kissing you and all of those foreplay, ensure to do away with that, just to prevent the exposure rate, because you don't know if your partner has it,
True.
and if your partner or you have it and you transmitting it to your partner. However, if in the same household your partner has COVID-19, you want to ensure to have a physical, social distance from that person, and avoid having sex with that person until they are being treated and proven, tested that they are negative before you can proceed with any intercourse.
Now, how has the COVID 19 epidemic impacted the drive in achieving the end of the HIV epidemic?
Due to the dynamic work of the COVID 19 response team, we were able to mitigate the spread of COVID 19 that was done in 2020. And as such, that gave us the opportunity to carry out some outreach and testing, which yielded to about 800 and more persons being tested and knowing the status. And those that know the status that turn to be positive, we link them directly to care to ensure that they start treatment as soon as possible to ensure that they are not it will migrate from HIV to AIDS. However, one of the key strategies that is being put in place by the Ministry of Health, the National AIDS Secretariat, is the education. I can't overemphasize that. The education, educating the public, educating people about what HIV is, how to prevent being exposed to HIV, the measures to put in place to ensure that people will not contract HIV. If you're HIV positive, how you can assess care and how you can ensure you're taking medication to bring down the viral load and all of those stuff. As such, we have been doing our routinely checks, the routinely checks in schools, educating the young population and also the adults about what HIV is. But of course, COVID-19 had played a negative effect on that aspect. We can visit schools, we can visit business places to educate them about that, and we are only waiting to see how, by the grace of God, this COVID-19 will be 100% under control and we go back to high functionality and achieving our purpose. However, thank God for the internet. We were able to reach out to some of the schools like Baste High. Shout out to Baste High School team. They did a wonderful job. We had a Zoom interaction meeting with them and we educate the students, and it was a very interesting time. And we're able to pass on information to the school and letting them know and the students about what HIV is, about sex education, about abstinence, and so on and so forth.
Okay. Now, Dr. Offrey, COVID 19 is referred to as a pandemic, and HIV/AIDS is referred to as an epidemic. However, both of them has really spread throughout the entire world. So why is one referred to as a pandemic and the other one referred to as an epidemic?
I want to say this in a very layman explanation. Pandemic, we can see that it is an effective, presently effective, and practically escalating in a very exponential rate. Why the epidemic, when it comes to HIV, it is spreading, but it's not as rapid and escalating as coronavirus in a very layman explanation.
Okay, good. Now, are there any interruptions in services to non communicable diseases, the clients at the health centers? Of course, the Caribbean has been plagued with non communicable diseases, a lot having to do with lifestyle, our salty diets, and we like a lot of sweet things. And lifestyle, it's a lifestyle disease. So, are there any interruptions in those services at the health centers?
It's truly affected. And during this time, you can see on the Facebook page, the Ministry of Health says that all the health centers still open from 8 o'clock to 4 p.m. But all health centers thought I continue their services. But It is like, however, the client is suggested not going to the health centers because it would like to reduce the chances to get the contact chances with the COVID-19 cases. Yes, and in this case, the health centers that will contact their clients by phone, yeah, to call them to ask if they're okay, if if they feel okay, then they will be fine to continue to take their medication, and if they are not fine, so they will help the clients, their regular clients, to seek seek other assistance for them. And if those clients they don't know how to seek help, they can call 311 as well in either way. Yeah, to call them to figure out the contact number of health centers so they can call them to seek assistance from them. Yes. And in this case, the medication can be delivered by the medical staff as well, or the meeting, I mean, the medication meeting can be arranged to get for the clients, they can get medication at a convenient time for both clients uh, and also the medical staff. So the health centers, they can remain normal functions without any chaos. And it's not really, it's interesting because it's not like the AIDS, it's not like HIV, that the non-communicable disease, it's more the patient, the uh, non-communicable disease patient, it's how can I say it? It's vulnerable, but it's not really infectious. So it's chronic disease. So it's not really urgent for them to go to the health centers or medical facilities right away in this pandemic, in this critical time.
Right. So it's really not transmitted from one person to the other,
Yes.
as in AIDS and COVID 19.
Yes.
But however, people are more predisposed based on genetics and all of that sort of a thing in the family, and life, it's more of a lifestyle. They're all lifestyle diseases,
Yes,
really.
true.
But it's not transmitted
Mhm.
in the way that HIV, AIDS, and COVID 19 would be transmitted. You can't get hypertension or diabetes from me talking to you.
Yes, yes. So it's not infectious. Yeah.
It's not infectious. Right. Now, people with living with HIV, Dr. Offrey, are they, or William, are they at higher risk for contracting the COVID 19 than other persons?
At this present time, we are still learning about COVID-19. That's the truth about it. We still learn about COVID-19 and HIV. However, based on limited data, we believe that people who have HIV are and under treatment and that adhere to treatment are of the same rate of exposure rate, and also the symptoms or side effects of COVID-19 itself. Exposure, the same thing. However, note this: researchers many researchers are doing further investigation and research to find out how people that have HIV can live with COVID, and can live or be treated with COVID-19 as other persons, and how the treatment effects can be on those living HIV. Nevertheless, this further research will, of course, yield positive results down the road. However, we should also know that older adults and also adults or people of any age that are seriously have serious underlying medical conditions may also be at a high risk of contracting COVID-19. As such, we encourage that they do what they have to do in terms of ensuring that their immune system is up and running, up and running as effective. Nevertheless, due to deplete of immune system, they can be predisposed to this, coronavirus and so on and so forth. So we encourage that they eat healthy, they sleep well, they ensure, that they check their lifestyle to ensure that they are not doing anything that would cause a deplete in their immune system.
Now, vaccination, does having HIV prevent you from taking the COVID 19 vaccination?
HIV does not stop you from taking the COVID-19 vaccination. In fact, we're encouraging people to take the vaccine. It's important. It is a very serious chronic disease that when affected, when infected, it affects your whole system. So we encourage that those that have HIV should go ahead and take the vaccine, and also ensure to keep taking their their antiretroviral treatment, you know, to ensure that they keep themselves healthy and bring down their viral load, and also ensure that their CD4 count is up.
Right. So that is one way in which HIV persons with HIV can prevent themselves from contracting the COVID-19 virus. What are some other measures that HIV persons living with HIV can take to prevent themselves from contracting this virus?
Some of the measures they can put in place is to first of all ensure that they take their medication. And second, staying away, social distance, staying away from gatherings, staying away from people that are, possibly, not people, let me say, staying away from people, from gathering, because in that medium they can be exposed to coronavirus. And also ensuring that they live a healthy lifestyle by eating right, ensuring that they exercise right, ensuring that they sleep at least 8 hours, and reduce stress as much as possible, because stress can also cause a deplete in your immune system. So those measures, if put in place, can greatly mitigate the chance at which they will be exposed to coronavirus.
Yes, and while we have not mentioned it, people are not just dealing with physical health, the challenges of physical health, but the mental stresses really that come with, for example, the lockdowns and just the mental stress of having to live in an environment, where you have to be safe and secure and so on and worry about not really contracting the COVID-19 virus can lead to additional stresses, which of course can even further impact your health and further affect your immune system if there's those stresses.
I understand the socioeconomic impact of this coronavirus, which is something we can prevent at this present time. But we have to also, you know, it's either we allow the stress that it is to greatly affect us, or we learn to live with it and see it as normal, as a norm at this present time, until when we go back to the sense of normalcy again as we normally know it to be. So the stress actually, psychologically, you have the ability to reduce the rate at which you respond to situation. It's either you choose to be optimistic, despite the fact that being realistic is inevitable, but it's advisable that you be optimistic. Try to see positive in every negative, despite, yes, it is what it is. Should I stress out myself and increase cortisol production in my system that would lead to, more problems down the road? Or do you know what? Just say, I will do what I have to do as directed by the government, and say, stay home, social distance, put on your mask, do what you have to do, and consider it to be part of life, and it will not greatly affect you psychologically as it would if you allow it to be.
Right. Now, William, the of course the partial lockdowns and sometimes 24-hour lockdowns and so on can impact upon the health of persons living with non-communicable diseases. What advice would you give to those persons in terms of how they can manage these situations?
Okay. We all know that because as Mr. Williams say and Dr. Alfred say, lockdown can be lead some poor management of NCD, and especially if you have unhealthy diets or physical inactivity and tobacco use or harmful use of alcohol. This is risk factors for NCD patients. So if I were the NCD patients, I would suggest them, like Dr. Alfred said, to have balanced diet, especially the plant-based diets, because the plant-based diet they have antioxidants or vitamin D, vitamin C. Those antioxidants would help to prevent, like to strengthen your body immunity. And then second, I would suggest to keep you hydrated, because just a few because like we are made by water, like 60% of water. So I would really recommend to everybody like to have 2 liters of water at least a day to keep you hydrated. So we can keep our body function normal. And the third, sleep well, at least 8 hours. Yeah, as Dr. Alfred say. Yeah, and so sleep well will help us to reduce the stress as well. And the fourth, doing some stress at home. That this is really important, like because now it's the partial lockdown and it's not really recommend go out to exercise. And so I would suggest if you stay at home and you can do some stretch or you can do some yoga to reduce your stress. And this exercise, I mean stretch or yoga will indeed like it's like it can make you happier. Yeah. So it really helps your immunity. And the fifth, try to reduce, when we stay home, probably we would have more alcohol consumption. So I would strongly recommend to reduce tobacco and harmful use of alcohol. Yeah, that's some ways that I would recommend to those NCD patients. Yeah. And I want to supplement, like, I want to say that in recently there's an outbreak in Taiwan. Yeah, the COVID-19 outbreak in Taiwan, and the accumulative death is now 530 something, and most of the death cases um, are NCD patient. I would say there's a 60% to 70% death cases are NCD patients. So it's a really severe issue.
Now, while you speak, William, about the reducing alcohol and tobacco use, sometimes you find what happens in situations like what we are having now with partial lockdowns, with full lockdowns, with certain societal restrictions and so on. All of these stresses can actually lead to an increase in alcohol and tobacco use because people are trying to cope. When you think that their socioeconomic situation has really plunged because of the COVID-19 situation, this can lead to them certain coping mechanisms, such as alcohol and tobacco, increase in the use of those things.
It's true, but as it's for the management, for the self management, I would still say that strongly recommend because it's for your own good. Yeah, so you still like even if you're stressful, you can listen to the music, you can watch Netflix, you can watch whatever you like can like distract you from tobacco use or alcohol use.
So at the
Yeah.
end of the day, it's about how you manage your health.
Yes, yes. And it's really vulnerable to coronavirus for those NCD patients. I have to say so.
Now, why is self management so important to NCD patients during the COVID-19 pandemic?
As I say that people with underlying health conditions such like non-communicable disease, diabetes, cancers, or heart disease, yeah, they are more likely to have severe illness, even death. Yeah, so in this case, under this partial lockdown, so I would say, and as I say, the Taiwanese example, so it will be it's very important for the NCD patient to take care of themselves. Yeah, because 70%, 60 to 70% of the death cases comes from the NCD patients. Yeah. So in other words, if they can self-manage their chronic illness better, so they can reduce possibility to get COVID-19 disease and become very ill.
Dr. Offrey, can HIV medication be used to treat COVID-19?
Currently, HIV medication, HIV or COVID-19, it has a very limited treatment. However, evidence have shown, or evidence have not shown, I should say, evidence have not shown that the medication used to treat COVID-19 could replace the treatment for HIV, vice versa. In other words, those that are under any treatment for HIV should adhere to the use of their treatment and regimen. And also, if they're exposed to coronavirus, still being treated for the coronavirus. However, people who have HIV should not, on their own or recommended by anybody, switch their treatment to the use of any treatment used to treat COVID-19 because they feel, oh, you know what? It could treat coronavirus. It could treat HIV virus. So perhaps it could treat coronavirus. That should not be the case at all. Some clinical trials look whether if they're looking at whether the medication that is being used to treat COVID-19 can be used, as alternative to treat, HIV. But no data has proven or shown anything that it could be done that way otherwise. That could have been passed on already. So we encourage with all effort that people that are taking are under HIV treatment should continue their HIV treatment. And those that are also, have COVID-19 should ensure to adhere to the treatment, So it's important to ensure that people stick to whatever direction provided to them by the physician.
What is the treatment for COVID-19? Because that's a question that many people have been asking. There are some people, of course, who recover on their own just by taking basic things like drinking a lot of fluids, as was indicated, boosting their immune system, taking paracetamol if they have a fever, and things like that. But then there are others with severe COVID that may have to be put on a ventilator and have to subscribe to other treatment.
Yeah, the thing about it is that yes, some persons actually are exposed to that. Your body can produce an antibody that could possibly fight COVID-19, but it doesn't last that long. However, it lasts for about 90 days, and that it depletes, and you can be reinfected. And when being reinfected again, could be very, very, very severe, and you might be hospitalized if not dead. However, a friend informed me about the information, told me about a friend of his that was exposed to coronavirus when the vaccine was not available. He was okay, and then got reinfected again, and it became very severe, and he actually died from that. However, we are encouraging now that we have the vaccine. Why wait? I hesitate. People should go get vaccinated, and that's why we keep singing the song "Roll up so all we can all roll out." So ensure to get yourself vaccinated and do not feel like your immune system is 100% formidable to the virus.
Okay, can you tell me in a nutshell what the role of the ministry is in terms of addressing COVID-19 among people with HIV?
Despite the current situation of COVID-19, testing of HIV continues. Treatments still remain available and free, of course. So in all, you can get a test done in all the health centers, in the hospital, and also in the HIV secretariat in the Ministry of Health. And commodities are also made available in all of those areas, even some pharmacies, even some, labs, like private labs like QDL lab, NextGen lab, Avalon lab, and so on and so forth. Free commodities, you know, condoms, lubricants, and so on and so forth. So the Ministry of Health, is ensuring that there is a continuity of availability of those commodities, essential commodities, to ensure that the citizens and residents of this beloved federation is kept safe. And the information, we're always there. You can call 311 still and say you want to speak to Dr. Ofre in the Ministry of Health, in the HIV Secretariat, and they will link you up to me. And then, I'll give you all the necessary information that is needed and then link you up. And also notice, the Ministry of Health, also had employed a case manager. So in other words, if you are HIV positive and you are confused on how to proceed with getting your vaccine due to the lockdown, due to getting your treatment, medication due to the lockdown, due to the travel restrictions, and you are concerned about that, you can call 311 and they'll link you up to the case manager, and she would ensure that you get your medication. She'll link you up to the physician that you need to be linked up to, and also get your treatment as much as possible. In fact, the pharmacy at GNF has extended that time, services to Saturday. So people can always just walk and get their medication at will, and also call, and then we make the medication available and accessible to them whenever they need it. In fact, we have the 3-month supply of it anyway to each client to ensure that they have. And they need to do their own part by adhering to the treatment.
Okay. Now, what do we know about COVID-19 vaccines and HIV? Of course, we know that we do not have a vaccine for HIV. Since it began, what's it now? It's over 2 decades now. There has been no vaccine for HIV, but we have COVID-19 vaccines. What do we know about COVID-19 vaccines and HIV?
COVID-19, as we know, the vaccine is available, is accessible, and of course, it is free. So without wasting time, we know that it is there, so people should go out and get vaccinated to mitigate the chance at which they will contract the virus and also spread the virus. Because if I get vaccinated, if you get vaccinated, we are ensuring that the nation is safe despite the presence of it. It's just like building your house. You can build a house and have a window and have a door, but we still ensure to put burglary for further protection. And that's why we're encouraging people to go get the burglary by the vaccine, by taking the vaccine and putting that the vaccine serve as a burglary, further protection in case you are being exposed to the virus. And in the case of HIV, we have testing sites available. In fact, even private labs. We have private labs are being certified to test for HIV. So rapid testing, in less than 15 minutes, you test it and you have your result and you're good to go. And of course, we encourage that after 3 months, you should do another testing. And also ensure you protect yourself while involved in sexual intercourse by using, protection commodities like condoms and, dental derm, in sexual intercourse and so on and so forth. The enteroderm is actually a material used for those that want to do oral sex, to place over the vagina, to ensure prevention of fluids into your mouth and on and so on and so forth. So those actually helps to prevent the exposure rate of HIV. So now you can get tested in all the health centers. Now you can get tested in the hospital. Now you can get tested in the labs. Now you can get tested in the Ministry of Health and the HIV Secretariat. And the medications and treatment is available. In medicine, we say a disease that is well diagnosed can be well treated. The early diagnosing of HIV can help to ensure treatment, to bring down your viral load, and you can live a long, productive life. So if you say, you know what, I don't want to know, but what I don't know will not kill me, that notion is completely false. It is completely false. So what you know how to ensure that it doesn't kill you. Before it progresses to AIDS, it can be handled while it's HIV.
Right. Well, that brings us to the end of this interview. I want to thank you, both of you, Dr. Matthias Offre, who is the National HIV/AIDS Program Coordinator in the National AIDS Secretariat, and Mr. William Chen, Project Manager for the International Cooperation and Development Fund. Thank you to both of you. So happy to have you here, from Taiwan. Of course, as you know, Taiwan is facing an outbreak at this moment after they would have so successfully managed the COVID-19. Just like us here in the Federation.
Yes, true.
We successfully managed for a very, very a time, and now we're having an outbreak, but we continue to, to do our best to bring it under control. Thank you to both of you.
Thank you so much.
Thank you so much for listening to this interview. I am Les Roy Williams.